Good morning, and thank you very much. Welcome to this workshop on health systems interventions to prevent firearm injuries and death. My thanks to Dr. Zhao, Dr. Schuker, and especially my longtime colleague, Dr. McGlynn, for opening the workshop for us. This is sponsored by Kaiser as well as the American Hospital Association, as I'm sure you're aware of by now, and we are very, very grateful to them for providing that support and giving us this opportunity to explore this critically important topic. The Planning Committee, which we've assembled, is also extremely grateful for this opportunity. They're a group of experts that's very knowledgeable in the field, and I've gotten to know them over this very short period of time. Victor's mentioned the fact that this workshop has come together in a short period of time and that it's a priority for the National Academies to refine its processes so that they're more timely. It's been just over 60 days since I got the notice to chair this workshop. As chair of the Roundtable on Population Health Improvement, and prior to that, the Roundtable on Health Literacy, I've overseen about 40 workshops. This workshop has come together in record time for all that experience in about 1/3 of the typical time. So we're accomplishing that objective, Victor, and I think we're, for the sponsors, for those on the Planning Committee and those at Kaiser and the American Hospital Association, I think we're beginning to address this topic in record and appropriate, urgent timeline to begin to get the answers and the issues on the table that we need to identify. So I'd like to welcome you all again and let everybody know that this meeting is being live streamed online and is being recorded and videotaped. And for those of you who are on the webcast, you will be seeing us, I understand, in the typical panel where the video is, and underneath that panel is an opportunity for you to enter questions or comments as the workshop unfolds. And as we go through the workshop and as we get to the question and answer periods that are identified in the agenda, we will go to those questions as time permits. So I want to, right at the beginning, right at the outset, highlight that opportunity for you, and as thoughts begin to occur to you online, please begin to enter them in your notes so you can send them on to us and we can answer them in real time. That also goes for those of you here in the audience as well, so that we collect our thoughts for good inquiry during the process of the workshop. As we begin today, my special thanks to the Planning Committee. I am a senior fellow at the HealthPartners Institute and former medical director and chief health officer at HealthPartners, but I am not an expert in this topic. I'm here because I have had a deep experience in health systems and prevention, but I have learned a great deal from this tremendously talented group of Planning Committee that's been assembled for helping to plan this workshop. They are identified in your program materials, and I want to make sure that we recognize the important contribution that they've made. In addition, the Academy staff, under Rose Martinez's direction, in particular Melissa French and Alexis Watojas, I apologize if I've mispronounced your name, Alexis, we know her by Alexis, have been incredibly important in terms of putting together and facilitating the process by which we've been able to plan this workshop. I was pleased to ask to chair this committee because I think it's an important topic, and I'm apparently not alone so far in thinking that thought. Tens of thousands of people are killed each year with firearms, and tens of thousands more are injured. It's been estimated that firearm-related injuries cost health systems $3 billion or more dollars a year, direct costs alone. This number does not even begin to address the costs, financial, emotional, psychological, borne by families and communities in the long term. Health systems, I believe, can make a difference. Health systems see millions of patients each year, not just in emergency departments and hospitals, but also in primary care and specialty practices. Health systems conduct research, engaging in quality improvement, work to translate those efforts into the best possible day-to-day care for people they serve. Finally, there is a strong precedent for health systems and the healthcare provider community to address issues like the prevention of firearm injury and death. They do have a track record in terms of making impact, health systems do. They have developed this track record by implementing best practices based on good science, and as the result has had substantial impact in contributing to many public health issues. One of the most key questions I was asked by one of the members of the planning committee on one of the last calls was, have health systems ever really done something like this before? And yes, they have. I've tried to assemble some examples to show you that. So, for example, from my own experience in Minnesota, over nearly 3 decades, tobacco use reduction is an example where health systems have contributed to the impact. Different from the issue of what the most critical intervention is, but the contribution to that result. So in our population there, in Minnesota, of over 1 million individuals, the tobacco prevalence has fallen from over 20% to about 10%. The methods by which we contributed to that, specifically as a delivery system, was identifying tobacco as a vital sign in the medical records, making sure at every encounter we asked and advised and connected smokers with advice and quit line. And those are some of the things we did to also contribute to the public health interventions which were also going on in Minnesota and the community and other health systems. So we have a role, and therefore we have a part of the credit for the success of the reduction of tobacco in the entire state of Minnesota. I suspect that's also possible for this topic. And I think that thinking about what the role is of health systems in terms of what our role is in addressing this significant public health debate is the very critical and important question that Kaiser and the American Hospital Association has asked us to address today. So, similar examples I can draw from my career in cancer screening and early detection. I remember when, and I'm old enough, this year is the 50th anniversary of the year I entered medical school. I'm old enough to remember when screening for breast cancer was a fraction of what it is today. I'm old enough to remember when the U.S. Task Force initially put out its reports and began to excite primary care physicians about what they could do for prevention. So this is a start we can make. We need to have the self-confidence and the optimism to begin to think about what we can do to make a difference in this important problem. The charge to the Planning Committee by the National Academies is an important aspect of setting the boundaries and setting the objectives of what this workshop will do. And this particular charge to us has a couple of things that it includes. First of all, and I quote, we're to plan a 2-day workshop that addresses the research needed to enable healthcare systems to be more effective in preventing firearm injury and death. The workshop will focus on the evidence and best practices by health systems and healthcare professionals in preventing gun injuries. And then there are subpoints, which I won't go over at this point. In addition, that charge also indicates panel discussion should not focus on regulatory or other public policy approaches or interventions related to firearm sales, manufacture, or ownership of firearms. The workshop will focus on primary prevention and not the acute care or rehabilitation services for firearm injury victims. So those other things are important, but they are outside of the scope of our conversation today. And that charge mechanism that the Academies has helps us to focus in terms of creating a conversation that will help us provide a useful set of conversations to develop interventions that will be helpful in addressing this important issue. I am sure that we're all aware that the controversy surrounding firearms in the United States is a difficult topic to address without stirring up strong feelings, but there isn't any controversy in what this workshop seeks to address. Trying to figure out the best way to keep people alive and healthy is what healthcare providers and healthcare systems do, and that's what we are here and focused on to figure out over the next 2 days. So with that in mind, let me go over our plan for the discussion today, and I'd like those involved in the first address and the panel to come up to the table at this point. So the rest of the day is structured in 5 segments. Next, Dr. Stephen Hartgarten will lay out the problem for us and take an in-depth look at why health systems have a role in preventing firearm injuries and death. After that, we'll have 2 presentations examining the toll of these issues on individuals and communities, followed by a panel with presenters. So be sure to save your questions for the moderated discussion, which will follow our initial presentations to that panel. So we're going to go through a number of these presentations. I want you to hold your questions, and for those of you on the webinar, make your notes. And then the Q&A, we have a very substantial Q&A period that follows these first 3. That's when we'll do the engagement back and forth for us on the panel. I have got up early this morning because I was thinking about this and generated a whole page of questions myself. But I want you to do the same, because that's where we're really going to tease out from you the important things that we need to know and take home from this workshop. So be in mind that we're going to hear some stuff, and then we're going to have that opportunity. The first panel session will wrap up about 11:45, at which point we'll break for lunch. Then there'll be, and that complimentary lunch will be provided in the Great Hall. After the break, we'll reconvene for the second panel on identifying individuals at high risk for firearm violence. And the third panel of the day will focus on health system interventions as we move forward. Both of these will also be moderated in the same fashion by these Q&A periods of time where we'll tease out some of the issues and answer your questions. The first day of the workshop will end with a final panel of speakers highlighting the key issues from the day and a moderated discussion.